Hello, my name is Kevin Rollins. This is my health promotion video for Healthy People 2030. Um, the overall goal of Healthy People 2030, um, it is a data-driven national objective to improve health and well-being over the next decade. This came out in and around um, 2020. Of course, my personal choice was, as you see in the corner, heart disease and stroke. However, I kind of shot the difference, and my personal choice for uh, for this program is hypertension. Um, the U.S. Preventative Services Task Force recommendations for hypertension was all adults ages 18 or older should be screened in office for hypertension. A little background on hypertension. Um, that is a systolic or elevated diastolic blood pressure reading. Uh, per Dr. Vidal Pito, hypertension is defined by the 2017 American College of Cardiology / American Heart Association levels of a systolic blood pressure reading above 130 or a diastolic blood pressure reading greater than 80. Um, those numbers were cited from the SPRINT trial, the systolic blood pressure intervention trial, and the U.S. Preventative Task Force has defined sustained hypertension as blood pressure measurements that are high both in clinic as well as out of clinic readings. Um, our assessment of hypertension, as I stated earlier, depending on the text and the certain protocols, um, anywhere from 130 to 140 milligrams of mercury systolic and 80 to 90 milligrams of mercury for a diastolic reading indicate um, hypertension, and that level should be then treated. Hypertension overview. The pathophysiology, hypertension can cause, for lack of a better term, stretching and loss of compliance of some blood vessels, which is where we see the increase in blood pressure to push blood flow through those less compliant blood vessels. Hypertension is a risk factor, of course, for MI, stroke, heart failure caused by ventricular hypertrophy, and it is also a risk factor for erectile dysfunction in men. And that erectile dysfunction, according to a article by Kotsis and Soutsis in 2023, says erectile dysfunction can precede coronary artery disease by upwards of 2 to 5 years before there's any actual heart issue. A more pressing issue is men are not able to be prepared for action, for lack of a better term. Screenings for hypertension obviously requires the use of a sphygmometer. If you cannot say the word like I have trouble doing, blood pressure cuff. Automated blood pressure cuffs as well as manual cuffs are used in the office. That is the office blood pressure management. Ambulatory blood pressure measurement are taken outside of a facility. These could be outside of a doctor's office, such as the kiosks at Sam's Club, um, even like at health fairs, um, ambulatory screening. Home blood pressure measurement can be used, as you see, with either the manual or an automatic cuff. Recommended over the brachial artery for its best reading. Those can be done, at home multiple times of the evening. The recommendation is to do those um, about 5 minutes apart after sitting with the arm at the height of the heart for the most accurate reading. And then, obviously, if you're in the hospital, especially in ICU, OR, cath lab, things like that, arterial lines are used for blood pressure monitoring. Those are not for ambulatory office care, so those will not be discussed any further. Of note, there is a situation called masked hypertension where the blood pressure readings are elevated either in home or ambulatory measurements, but are normalized in office um, blood pressure measurements. And then, of course, as the opposite effect, we have white coat syndrome, which is where you're in the doctor's office and the blood pressure reading is very elevated, as opposed to being at home or at some ambulatory measurement and it is normalized. And that information, of course, was um, received from a um, journal article by Carey et al. Um, and the white coat hypertension is, of course, from the U.S. Preventative Services Task Force. They want to clarify the differences. That way, there is not unnecessary treatment versus necessary treatment. Next, we're going to talk about prevention. And this is key for nursing currently and in the future. The number one step in prevention is health promotion. And this all came from a article in Circulation Journal from the American Heart Association. The authors Carey, Wright Jr., Taylor, and Welton in 2021. That's a great little article to read, by the way. The DASH diet, um, as well as diets with sodium levels below 1,500 milligrams or 1.5 grams daily, as well as diets that are high in potassium levels, because, of course, potassium and sodium are in an adverse relationship. The higher the potassium, the lower the sodium level, and the more water excretion that can be obtained, which will lower fluid levels and make the blood pressure lower. Next, we have exercise. Um, the American Heart Association recommends 30 to 60 minutes of aerobic exercise 5 to 7 times weekly. For most nurses, we do well past 60 minutes of aerobic exercise on a daily. We can get 12 hours of aerobic exercise 3 times a week, and that seemingly will balance out. In addition to prevention, our next part of prevention is obviously medications for blood pressures that do not resolve with lifestyle modifications such as exercise and diet. Um, with medications, there are many different classes. Um, some people will be on some classes of medications, some will be on others. It just depends on their pertinent situation. This was all obtained from the American Heart Association journal, and it gives us the following. Usually, blood pressure treatment starts with a diuretic just to lose excess water. That way, that will lower blood pressure. Normally, we start with thiazide diuretics such as hydrochlorothiazide, um, and then thiazide-like diuretics such as chlorthalidone, which has a longer half-life than hydrochlorothiazide. Um, after that, depending on the doctor, depending on the situation, we have our ACE inhibitors such as lisinopril, enalapril. There's many more in the class. An adverse effect of ACE inhibitors, of course, is angioedema and the dry cough that comes with that. For patients not able to tolerate ACE inhibitors, we do have the angioretention blockers, or ARBs. These include losartan, olmesartan. Um, they are similar in mechanism of action as the angiotensin converting enzyme inhibitors, um, but they're also a little different. They do not tend to have the dry cough that makes the ACE inhibitors um, less likely to be used. Um, One thing to watch out for with um, ACEs and ARBs is an increase of potassium, especially if you're on a diet with salt substitutes or increased potassium intakes. That can be problematic. Of course, excess potassium can be problematic for your heart through the EKG um, with your T waves, especially. Next class we have in the green above me here, calcium channel blockers, specifically the ones that end in PINE, such as amlodipine, nifedipine. Um, these help to relax blood vessels. They also block the calcium channel in the heart, and that helps to slow down um, your heart rate. Um, Something to watch out for with calcium channel blockers is lower extremity edema, where it relaxes the blood vessels in your legs. Blood will have a tendency to pool there. And finally, here, the most common um, medications that we have, beta blockers. Um, these all end in LOL: metoprolol, atenolol, bisoprolol, um, labetalol, among others. There's quite a few. These act on your heart through your beta 1 receptors. These help slow down your heart rate and your um, contraction force. These are common when you've had an MI or you have coronary artery disease specifically. Um, they help decrease the force of contraction to allow for your coronary arteries to fill more fully with blood. Those are given to help with angina and things like that. Usually, per the American Heart Association, beta blockers are not first line blood pressure medications anymore just because there are better medications. Um, Usually, the first line treatment for hypertension are your diuretics like thiazide diuretics. Of course, I didn't go over things like vasodilators like hydralazine. I didn't go over your loop diuretics like furosemide. Um, of course, and other centrally acting medications like methyldopa and clonidine that are treated in blood pressure as well. Agencies that can assist with hypertension as well as cardiovascular and stroke prevention around the Beckley area are places like HealthRight as well as your local um, health department, like the Beckley Raleigh County Health Department, um, provide low cost medical services and they can help you obtain low cost prescriptions as well. Um, for our exam questions, I have utilized the first question is what is generally the first line treatment of hypertension? And that, of course, was thiazide diuretics. Number two, what is the U.S. Preventive Service Task Force recommendations on hypertension? And that is all adults should be screened in office for hypertension. Um, very simply stated, your yearly checkup, get your screening done. If you need meds, great. If not, even better. Number three, which medication class is not considered first line treatment for hypertension? And as I stated on the last slide, that is, of course, beta blockers. Unless you have had um, coronary artery disease or you have like reflex tachycardia or SVT, things like that, that you actually need more rate control. Finally, we have our references here. Of course, the American Heart Association for types of blood pressure medication. Carey et al. Guideline driven management of hypertension in the Circulation Journal. It's a great journal. Of course, the Kotsis and Soutsis article about erectile dysfunction and its correlation with arterial hypertension and cardiovascular disease. That was actually great information I did not even know existed, among others. And finally, I would like to express thanks for allowing me to give you this presentation today. I greatly appreciate your time. Thank you.